Yeah, so it looks like we do have a few new people on the call today. So I would love everybody to go around and do some introductions. And since John, you're already on camera, why don't you start?
Sure. Hi, my name's John Gresh. I've been involved in Odyssey for about 2 years now. Well, about 3 years now. I started when I started my job at the National Association of Community Health Centers, where I was until just recently. Our entire department got let go, so I'm currently looking for work. My
Mhm.
background is primarily software and informatics. I've worked in all kinds of places, ranging from I started at Pfizer. I worked for a small EMR company called Modernizing Medicine out of Florida. I worked for United Healthcare for a short period of time. It was horrible. And most recently, I worked at the National Association of Community Health Center, where I was embedded in their data science team. And I was responsible for creating and maintaining their entire enterprise informatics system, which was based on Databricks. And we integrated with Odyssey. I set up their entire Odyssey instance, and we did walk through one study, our COVID study, from start to finish, starting with the ETL process and going right up to analysis and creating visualizations. And we were working on the publication when the funding for our department got cut and it all got shut down. So that's my background. And I'm interested in the survey data because a lot of the work that we did at NAC was survey driven. And a lot of the work that I'm kind of looking for is very much survey driven. So that's me.
Great, great. Thank you, John. And I think I see Piper. Are you new? Or Benjamin?
Um,
I also just saw you turn on your camera, so either.
yeah, so I did join the call, I think, last time, but
Oh,
yeah,
okay.
Bernallo, I'm at the University of Minnesota. I am co-chair of the SNOMED Mental and Behavioral Health Clinical Reference Group. And as part of my work at SNOMED, we have sort of a group of folks that have been looking at enhancements to the concept model for staging and scales, which is assessment instruments. Also recently have started working with a behavioral health project group through HL7, which is doing very similar work. They're looking at the how to modify resources and profiles for better exchange of assessment data. And then separately working with Andrew Williams, who's leading the Odyssey Psychiatry work group. And that work group is also doing work on assessment instruments from the perspective, less from the perspective of modeling them and more from the perspective of sort of understanding what assessments are most commonly used in healthcare and how we need to enhance the OMOP vocabulary files, right, to be able to represent assessments. And then finally, so my dissertation research focused on representation of assessments, but more specifically for mental health. And I currently have a K grant waiting for council reviews to resume so I can hear. But one of the three aims of my K focuses on an assessment instrument model. So this is an area where I have a lot of interest, and I was really excited to see that there is a dedicated group that is focusing on this. So I'm super excited to learn more about what y'all are doing and see how I can help in any way and how we can bring this broader community that currently is working in a lot of different areas together so we can get a lot done. So that's me. Thanks for
Yeah.
having me.
Thank you, Piper. And I appreciate you introducing again. We've had a bit of a break in our meetings due to all of the winter holidays, which is also on my list of things to talk about is how much we have to cancel on Mondays because of all the federal holidays and maybe moving our meeting time. Benjamin, would you like to introduce yourself?
Sure. Benjamin Burke. I am a clinical informaticist at Care Evolution. We have a research and decentralized clinical trials platform called My Data Helps. We've got a long history in health information exchange, and I focus a lot in terminology and conversion. I'm part of the FIRE OMOP working group, and recently joined as co-chair of the clinical and phenotypic data capture work stream at GA4GH. So kind of interested on the genomic side as well, or at least the phenotypic capture of which survey data is important. And in the My Data Helps platform, we capture a huge amount of survey data. We integrate with REDCap and are interested in standards and where we may represent this data in a standard way internally, but even more importantly, as we export.
Terrific. Thank you. Happy to have you on board. And then is there anybody else who hasn't been on the call before? Okay, so well, thank you for the introductions. Happy to have new experiences and help on board. And so before we talk about some of the stuff we need to tackle today, I did want to talk about possibly changing the meeting time. So we hit, especially from November till now, a lot of federal holidays are on Mondays, which means we end up having to cancel this meeting. And sometimes it's okay because there's background work going on and things like when we're running the landscape survey, but other times it's really annoying in terms of trying to get work moving forward. So what I wanted to do was send out a doodle poll to everyone who's on the invite list and who's been attending the meetings to see if we could find another regular time to meet twice a month and get away from the Monday thing. So we're not having to cancel so many meetings. If anybody have any concerns, we'll try and do that. Of course, we can't find another time. We'll keep the Monday, but I'd at least like to give it a shot. Okay, thank you. And if you're on this call but didn't get a direct invite to the meeting, please send me like an email or a message, and then I'll make sure you get added to the invite, and then you'll get agendas ahead of time. And as we also work to develop our 2025 OKRs, we're going to have to do some of that offline because our next scheduled meeting on the 17th will be canceled because of a federal holiday. So I'll have to do some of that work offline, and we'll do that through email. So I will get a doodle poll going, and we'll see if we can find another time. So the next thing I wanted to talk about was the a lot in late 2024 to put together a landscape assessment to get a feel for what the community, Odyssey community, has already been doing in trying to map survey data. So we're not reinventing the wheel, and we can learn from others' experiences. I was sort of bummed because the response was not great. Most of the responses we got were from this group. So on one hand, that's good. You're here, you're working on this. On the other hand, I kind of have the vibe that there's more going on, but it's survey. I will say Andrew Williams' group did work out, and they're looking to talk to somebody from this group and have us attend some of their meetings. So there is some potential from additional knowledge and information sort of sharing there. But we do need to be prepared to present our OKRs at the end of February. So I did want to start that discussion. And I think a review of the responses we did get from the landscape assessment would be helpful. So let me go ahead and find that so I can share it. All right, so we did it through Google Docs. I think it worked well for how we coded the survey. We got 10 responses. 2 of them were me testing it. So that's the baseline and overhealth and connect baseline. But the rest of these are ones either part of the community, either the cohort consortium community or the Odyssey community. So some of this basically will get this into a table format and share it out with the group. But what I kind of wanted to spend some time looking at today were responses relative to pain points and what kinds of things um, they've had to do to try to map the data. So let's see, language. Okay, so we'll start here, sort of the feedback as to help that is needed. Were survey data mapped to a common data of some kind? Majority, so 7 out of the 10 said yes. We had one who said no, one don't know, and one that plans to map to OMOP. And of course, yes, OMOP was picked for that. The version, so for the most part, current using version 3, 5.3 and 5.4. Tools that we expect, but what I was kind of wanting to look into a little bit were some of the written responses about sort of their best practices. So someone shared a link to their poster. Let's see, pre-coordinate items whenever possible. Answers to questions about clinical events should be mapped to standard concepts in their respective domain. Don't default to observation. Use type concept IDs to indicate patient-reported facts. Custom OMOP concept IDs should be created to identify specific survey questions, question response pairs, and used in source concept ID fields. If a non-standard code better describes the data point, use the non-standard code. And then our use case for adapting survey items to OMOP is very niche. I wouldn't necessarily recommend it to other groups. It requires maintaining a service contract and manually reviewing, depositing survey item records directly into. Instead, researchers simply attempt to map their survey item variables to existing OMOP standards as best they can. This tool is an example of a resource that I think may be helpful for those use cases.
So that are we discussing these at this point or just going through them?
Just kind of going through them with an eye towards how can we incorporate this information into our priorities for 2025.
Because all right, I'll hold my tongue.
Okay.
No, actually, I'm not. That solution to me seems problematic because there are a lot of standardized surveys that are encoded and have very specifically defined questions and very specifically defined answers. And if you just throw all of that out and map the result to just this is a condition or an observation or whatever table you're mapping it to, and this is the standard code for it, you've lost entirely that data was collected as part of this tool and it's part of this larger whole. Which in some cases is important to capture. So yeah, that's a nice, quick and dirty way to do it if you don't need to have all of that. But we should probably develop a standard that says, when you are working with these products, with these standardized question answer collections that are standardized surveys, we should probably collect all of that data and collect the fact that all of that data are related to that specific product.
Mm-hmm. Yeah, I definitely think there's a lack, and we'll see when we look at the pain points and how many items you're actually successfully able to map. That, yeah, this process needs to be improved, and it's highly likely this is going to involve adding to vocabulary and getting that accepted by the vocabulary group. So they're aware that we're having these conversations. They're looking to get feedback from other working groups as to what their vocabulary needs are. So I see us doing a significant amount of collaboration with that group in order to improve that process, having more meaningful alignment between questions and response pairs and what's in the OMOP model. And hopefully through that process, have some survey variables that become non-standard, like they're an accepted mapping for surveys. And because I think lots of times there's this not wanting to use non-standard, but the reason that vocabulary is put in there is because there wasn't something more suitable already in OMOP for mapping. So that's something we'll need to collaborate with and discuss with the vocabulary working group, which sounds like that could be one of our OKRs is to work,
Sounds
work
great.
with the vocabulary working group. So this next one, were you able to successfully map most of your survey data? And generally no. So about 2/3 were not able to successfully map. So again, even though this isn't a huge number of responses, it does say the people that are working this regularly are not able to successfully map as much as they would like to for their surveys. And then we talked about if you were not successfully, what were some of the issues? And I think we've probably touched on these, but new custom concept IDs were created to support the data elements of the survey instruments when they could not be mapped to existing terminology. Several issues with granularity and additional options meant that we had to create custom concepts. Unique questions or responses that aren't represented. I'm sensing a theme. A good portion of the survey item and responses are applicable to domains not captured by existing clinical standard vocabularies. Roughly 30 to 40% of the items did not map. In those cases, we made source concept also standard. Items that were where there is good overlap with EHR, conditions, procedures, etc., match the cleanest. So I think that's definitely a consistent effort, issue, that there's not the vocabulary there for the surveys. Okay, on a scale of 1 to 5, would 1 be none and 5 being the most, how much benefit did your team or broad data users gain from having data elements standardized according to OMOP? And these are three and up. And I think it kind of makes sense. I think there's the desire to have this, but the usefulness is somewhat limited relative to the issues that were already mentioned. What do you wish Odyssey could provide to help with this process? We plan to submit the custom concept IDs from the AI Ready project to Odyssey for consideration with the goal of incorporating some of these concepts. It would be fantastic if Odyssey could assist in submitting a formal request to the external terminology owner for adaptation into concepts where they have not already been submitted. So again, I think this is going to be collaborating with the vocabulary group to determine that additional vocabulary is needed for surveys. Love to contribute. Thank you from our experience. Changes to vocabulary standards should better be advertised vocabulary changelog should be more specific. For example, pre-coordinated items like history of X were recently made non-standard and replaced with post-coordinated history of and somewhat recently vocabulary update. These changes were not broadly disseminated. That is a good point, and I do think that's something the vocabulary group is working on. If social determinants and other observational domains primarily captured through self-reported data become a bigger priority for Odyssey, it would be very helpful to introduce widely used and well-known source instruments to the observation table so those can be mapped to standard concepts, and then other surveys can leverage those records for their own mappings. Would also be helpful to collaborate with other groups such as the Phoenix Toolkit community to prioritize and deposit instrument concepts based on needs of the survey community. That's very helpful. Thank you, we submitted that. I definitely think we will have to do triage as we talk about what vocabulary needs to be included, and using things that are very commonly used across surveys, but not necessarily available to standardized mapping, and OMOP will be one thing to prioritize. I'm somewhat familiar with the Phoenix Toolkit. I don't know if others are as well, but yes, I could definitely see that as a resource. So thank you for putting that. Got a sampling and coding languages, but the other one, I think these other two I think are also important for us to think about for OKRs is on a scale of 1 to 5, with 1 being not at all and 5 being very much. How much interest do you think the survey research community has in adopting OMOP as a common data model? And again, our responses are sort of in the 3 to 5 range, sort of 4 having the majority. So I think there's interest, but again, I think people have had challenges because of the lack of correspondence between vocabulary used for the clinical data and versus self-reported. And then the last question I wanted to talk about, I think, see, yeah, are what do we see as the biggest pain points? So there's no tool we can use to map survey instrument data elements. We vetted survey instruments. Well-vetted survey instruments should be published to the out-of-site GitHub sites so we can all learn from each other on how to map these survey elements. That was something I was hoping to get more of in this survey, or links to tools that have already been used. I think, as I might have mentioned, there are a couple other groups, like Andrew's group does want to talk to us. Oleg has talked to us about some of the work they've done with adding an additional field to the common data model. But hopefully maybe some more tools will come out of the woodwork. Well, also, I did have to postpone it so that we could work on our OKRs. But Jaya will also be sharing out a tool that he's using for harmonization. So hopefully we'll start being able to collate and add to tools that are available. None, lots of custom concepts, meaning that if we standardize it, it require a lot of additional concepts. So that again will be part of our vocabulary work. Mapping will probably be a substantial effort in terms of assigning a salary, which must be balanced against uncertainty concerning how much standardized data elements will be used for research. I think that's a good point. Do we need to figure out if there's more interest in the community to make it worth the effort? Lack of codes, as we've talked about, describing specific survey questions, answers, lack of survey applicable, commonly shared data elements, agreeing on standards, less flexibility when designing questionnaires, getting enough people to do it, having easy tools, all very needed. Mapping to non-standard elements, understanding utility before starting. So I think those are very good points. So I'm going to pause here. I don't know. Yeah, I think I'll let you read them on your own, but I think they reiterate a lot of what we've already discussed. So, we launched the survey hoping to get a feel from what the community needs. I think what we're hearing is a lot of getting more standardized mapping, more standardized vocabulary relative to surveys, and the tools to implement that. So I want to review last year's OKRs before we start thinking about putting some of ideas for this year into writing. But I did want to open the floor for any questions or comments or thoughts about the feedback that we've gotten, and what you feel like would be most helpful to you as far as priorities. Yeah, John, go ahead.
So going back to the idea, the question about, is this needed? How valuable is it? And how much effort? Survey data exists. A lot of people use it. A lot of data exists in that form. So I think that question is kind of moot. Yes, we do need it. We do need a way to catch it. And I think one of the things that kind of slows down, I call it inertia. Like in software, a lot of times if you're missing one little piece of information, it just freezes a project because you don't know the answer to that one particular you need that piece of information and you don't have it. And I think in projects like this, what really can slow people down is they don't know. They don't want to reinvent the wheel. They don't want to come up with their own solution and have people go, no, that's stupid. That's not the way you're supposed to do it. You're supposed to do it this other way. So I think one of the really important things is to say things like, yeah, it's okay to just, if you have survey data, and even if it is in an instrument and you have your data structured as questions and answers, it's okay to just map those values to a given concept. And here's the table that you should map it to. And then as far as existing concepts and non-existing concepts, then it just becomes a regular mapping problem. Do you have a concept that you can map that information to? And then say, yes, that's acceptable. And then here's this other methodology that's acceptable. So what are the acceptable, what are not acceptable? What are the standard methodologies? These are the standard methodologies that people use. And if you're going to go out and do this and don't want to reinvent the wheel, you should probably pick from one of these. Because that's what I'm looking for.
Yeah. Yeah, thanks. And I do feel like we're all here because we definitely have a vested interest in this. I think maybe some of the question is, as far as getting resources, is there enough outside interest to do that? And I do know this is a work group that they wanted for some time, but they haven't necessarily had a volunteer until I came along. So, yeah, so I think there's interest, definitely. Benjamin, you had your hand up next.
Yeah, a lot of the feedback in the survey makes me wonder how much energy should be spent on developing vocabularies that are going to be used in the development of surveys, right? And kind of putting out instruments versus efforts in mapping existing surveys, questions and answers to vocabularies, right? It seems like the problem here is pretty different than in clinical data, where we typically do have ICD-10, right, or HCPCS or something, for claims and for recording in electronic medical records, and those can be mapped over to SNOMED and such, right? And there's perhaps a lot more of a narrow domain in terms of the mapping. Whereas here, there's high variability, not just in terms of the content, but also in terms of how people want to ask a question, right?
Mm-hmm.
Like you can create instruments all you want, but it's very likely that any given research team is going to say, well, I kind of want to ask this a little bit differently, unless it's a very well used instrument.
Mm-hmm.
And so anyway, back to my main question is, how much energy should we be spending on trying to push people to use standardized surveys and instruments and code systems upfront when collecting data, versus in creating easy mappable things so that they can take existing stuff and map it to standards?
Yeah, that's a really good question. And I agree with you. In my experience, even if a well-used instrument is used as a basis, they tend to get modified a lot. So there may be some standards that we could, I don't know if convince is the right word, but offer for use in terms of really commonly asked questions, such as things in race, ethnicity, language spoken, things like that. But yeah, other areas, it might be harder to convince this is how you should plug it into your survey, and then, do modifications, make it too different to map to something that's been added to the vocabulary. So definitely some challenges there. Thank you. Brandy?
Yeah, I kind of agree with Benjamin, but on the flip side, I don't think we need to necessarily tell people, push them to use source. I just think we should make the assumption that a lot of people are, because they are using, especially instruments that deal with observational or social determinants. They're reusing a lot of that. It's cited in the literature. And so in that diagram you had, Nicole, where, a certain percentage was not able to map, I feel like that's where there's a lot of value, is figuring out what's not able to map, because many things can be mapped to a LOINC or a SNOMED or a measurement, and demographics included, but there's some of that stuff that's very self-reported centric, and maybe there's opportunities to look into the literature or something like, the Phoenix toolkit, and prioritize something that's standard that people are probably often reusing, so that you can add standard vocabs versus kind of creating. And I will say, I'm the person that provided that feedback to say, I really don't think you should go create a survey, a vocab based off of your specific instrument, because that's what we did. And it's not able to be repurposed widely by the broader community.
Yeah, that makes sense, because otherwise, well, basically, then you get to the point where you're not harmonizing, right? If everybody produces something very specific, then you're still not harmonizing anything. You're just adding your vocabulary.
It's just a lot of a lot of churning to get it there, but yeah.
So I appreciate that. Thank you, Brandy. John, you had another comment? Oh, you're muted, John.
Yeah, just to extend that idea and the idea of engagement overall. I know it's really hard sometimes to get people to engage in these activities. I get very poor attendance and engagement in the Databricks group that I'm currently chairing with Brad Reitmeyer. So I understand that it's hard to get the people to contribute sometimes, but wouldn't it be great if, somebody's out there we were talking about social determinants of health. Somebody out there has mapped social determinants of health from a prepare survey into OMOP. And wouldn't it be great if when someone did that, we could capture that, we could capture what they actually did and get that. And like I said, it would then be the next person wouldn't have to reinvent the wheel. They would have these breadcrumbs and say, this other person did it and this is the way they did it. And I also understand that there's some hesitancy to do that because, um, you don't want to open yourself up to criticism sometimes, and sometimes that's difficult too. But just as one of the OKRs for the coming year, can we get specific tools, specific instruments that are common? Can we get a guideline for that specific tool? And then to extend that idea, integration with existing fire instruments and with existing I really like the topic that Ben brought up. I hadn't really thought of that side of the coin, and I know that's going to be a huge can of worms of creating surveys, but kind of pie in the sky stuff would be, can we integrate with existing form constructions tools like L forms, and other fire tools and integration with SQL. So there's a lot of really elegant stuff we could do, but I think we really have a lot of groundwork to cover before we can get into those more advanced topics.
Yeah, I would agree. But I think it's also good to have your pie in the sky. I always call it ideal land. Like in ideal land, I would have X, but it's going to take a lot of iterations to get to that point. But I think it's also good to put those out there. You're working for, how close can you get to iteratively to an ideal situation, or as ideal as one can get in reality. So I think it's good to have those ideas out there.
And where are we headed? What's the horizon, and what's the
Mhm.
crawl, walk, run path to that?
Yeah. Like that. Any other comments? Yeah, I appreciate the discussion so far. Okay, so I'm going to go ahead then and switch gears a little bit, and we'll take a look at what we had as our OKRs last year. Okay, so this is what we shared out last year. We also have this available in the wiki, sort of as a record. It's also with our work group in the workbook group page that Odyssey maintains.
Wait, where's
I'll,
this wiki?
I can
Is it
put yeah, Layla, could you put a link in the chat to the wiki?
Yep, sure.
Thank you. And then we'll obviously add this meeting and our new OKRs to that. So unless anybody objects or wants to think about it for later, I'm pretty happy with our mission statement. Not necessarily looking to change that for this year, but if you want to look at it offline and have some feedback, we're certainly open to discussing that. But I did want to go through like how successful were we and some of the things we tried to do last year. So first thing we had to do was get established. So I think we did a okay job on that, or good job on it. We exist. We've had regular meetings. There's a typo here. It should be 10 a.m. We're part of the Odyssey work group page. And last year, we introduced ourselves to both the CDM work group and then also presented our OKRs at the community call. The next thing on our list was the landscape assessment, which we did do and got launched. We haven't put together a summary yet. That will be something that Layla and I work on together on our end. I don't think it's going to be a huge report, but basically summarizing the findings for that. So at least we got it set out, and now we need to spend some time looking at the results to it. The other two we had are a little bit more vague. Both Tom and Jim talked to us about their use cases, which is very helpful. But other than having those initial meetings, we didn't move too far on from that. We can think about if this is something we want to use again to help develop the priorities for 2025, or develop the use cases in general or add additional use cases. So that's something, like I said, we started, but we didn't dig into last year. And the last one we had from last year is basically find and apply for future support. Still a good goal. I can see having this for this year, but it is not something we got to last year either. So I'm happy we got the landscape assessment done, even though the response is not what I hoped, but I think we also have some good information to start with. What are others' thoughts on the use cases, especially Tom, you and Jim, since you shared those out, how might we leverage that for this year? And I would suggest that we also keep this OKR for 2025 as well, especially as we start endeavoring to do some more of the heavy lifting that will be involved in this. Monty?
Yeah, no, thank you. This is a very nice sort of overview of where we are and where we're going. I think the use cases are very critical, so that we now move into much more specific, learn how to do that mapping. And of course, that's always easier if there are groups that are already doing it or trying to do it. So maybe Tom and Jim, they can mention. I mean, we are trying to do not formally mapping, but we are developing data models for the generation study. So it will be interesting in maybe coming up with a use case as well. And in addition to that, there is the tools that could be as part of these use cases that are becoming available for the mapping, to first see which ones you can already map versus what requires. So I think we could come up with kind of quite concrete things that maybe can go in parallel and testing new tools. And I think that will give, at least myself, I think will give me a much better understand. And the survey is very good, and people that have responded are the ones who have spent more time. But I think, I don't know, people that have done it for a longer time, maybe they can chime in and definitely contribute to the use cases. But I think it's because there are no resources, either people that are doing it, have done it, or planning to do it. So it would be good to identify those.
Great. Thank you, Monty.
Yeah, hey, Monty, this is Piper. So like our most immediate use case has been just mapping the data that we have in our EHR. So we're bringing it into Odyssey. And, we started out with, of course, like PHQ-9 and GAD-7 from the mental health perspective, but we've had a lot of use cases for asthma assessment instruments. So I think that's probably a very specific, concrete use case that at least OMOP users have, is we have this immense amount of assessment data stored in our EHR, and we need to encode it. And what we found is that for 3 out of 4 of our asthma assessments, we had a concept for the total score, but for one, we had no concept. The assessment, the score, or any of the questions, none of that existed either in LOINC or SNOMED. So we had to request those just to be able to bring it into OMOP. So
Yeah, no,
again, that's a very concrete, it's not really use case specific in terms of a specific research project. It's more in terms of infrastructure.
Yeah, no, I think these are important. And when you're talking about data from EHRs, which I think when we move to the survey world, it might be even less easy to find the mappings.
Yeah, and I know to the point made earlier, when you think about survey data, I mean, it really falls into a couple different buckets, right? It's those validated, copyrighted assessments. And then it's the sort of, questionnaire surveys that are out there, like the nursing minimum data set, kind of standard surveys, but they don't really generate a metric, a score that measures something, necessarily. And then there's the kind of in-house custom questions, right? Surveys set up that nurses, for example, would fill out in flow sheets. So
Yeah, that's a good point. We should think about, I guess, if there is I was thinking mainly on the more custom made surveys, which
yeah.
I'm more familiar with in like some of the cohort studies that we've been working on. But I think that if there are standard, but there are more and more already standard. I guess we're trying to move towards having more standardized surveys. But you're right, there are some fields that already have standardized ways of assessing things, and maybe those are. Maybe it would be a bit easier because they're already standardized. The problem we have with the other ones is that they are not. We are all asking the same questions in different ways. There's no standardization.
Yeah.
And I would imagine, I don't know if there's someone with a clinical background can disabuse me of this notion, but I would imagine that there's a distinction between patient-generated data, and then I would imagine that there's clinicians that go through a checklist, like in a pre-op situation. I'm just making this up as I go. You know, there's going to be a checklist that allows a clinician to provide information rather than the patient, and I would think that those might be handled differently or maybe not. I don't know.
I think that PHQ-9 is a good example of like where a use case could fall, prioritizing standard concepts or measurements based off of what we collect through self-port questionnaires, but also is captured through the EHR. And that's an example of like, that's the standard form that you would give a patient, you would collect through a survey, you would collect it the same way in the EHR. It may not be entered in the EHR, it might be in a clinical note, so it might not be in a vocab, but something like that could be prioritized as a universal, like something to add because it benefits both. And then, so I think, John, for something like that, it's the same content, but then a researcher would be able to pull the source from OMOP to see whether it was collected via the EHR or collected through a questionnaire instead.
Okay, thanks.
Yeah, thank you. Tom?
Yeah, I'm kind of wondering, like, as maybe one place we could start, like, in thinking about like the cohorts and like from the cohort consortium is like I think there have been like these individual efforts to kind of evaluate questionnaire data, see what maps to concepts and certain vocabularies, but like I don't know if we've really like kind of compared our efforts to kind of say like, this is how we ask about, our reproductive variables, our physical activity, dietary assessments. Like we know the vocabularies don't exist, but maybe just to kind of like say like, all right, like, yes, we're all in agreement. Like, we asked reproductive questions in this way. They're basically trying to get at the same information. And yes, we know these vocabularies aren't available to us. So we need something just to kind of, bring together these individual efforts that have happened in some of these cohorts that we know are working on this. That's.
Thanks, Tom. Tamara?
Thanks. I'm going to echo Brandy and some of the others. But first, my main takeaway from this conversation in the last year and all of your great efforts, Nicole, is that there's no shortcut here. I think everyone wants us to say like, oh, let's write a computer program that just, and then like we have it. That doesn't exist. It will never exist. This is going to be slow, manual, and we're going to have to pick something to start with. We can't do it all at once. It's not a problem that we could solve with a fancy ChatGPT model. Like it just isn't. That's the big picture piece. But I want to echo Brandy and some of the others that maybe we should start with surveys that are in clinical use because they are way more standardized. The PHQ-9 is a fantastic example. Everybody uses the PHQ-9 to screen for depression. And there are others, I mean, maybe personal medical history type questions that everyone does these surveys when they go to, they're less standardized. But pick some examples of things that are in clinical use. They're much more likely to be standardized. They're possibly available in the EHR. They might more easily map to clinical concepts before we try to do like some of these SDOH concepts, which are near and dear to my heart. And then all of us, we use them and we love them, but like, is there high crime in your neighborhood? How are we going to map that in an OMOP? Like, that's just, it's not what it's built for. That's harder. Let's put those aside, and start with the things that are the lower hanging fruit, which are more standardized, more clinical. That would be my suggestion, I think, having heard all of this. And it's because it's so hard.
Yeah, that's really helpful, Tara. Thank you for that. I agree with your observations, and yeah, I think this has been really helpful. The clinical space sounds like a good spot to start. And again, yeah, this is going to be a year's process. Like by years, I mean multiple years, not of this year. So, there's a reason the CDM work group and the vocabulary work groups and the Themis work groups all exist in perpetuity, right? This is not, there's no such thing as a one and done. And so, yeah, picking some low hanging fruit and being able to get someplace, I think is really encouraging, as opposed to trying to do something that where we'd spin our wheels for a while. I think anything that's moving forward is helpful. And I think there's probably going to be lessons we learn from that experience that would help inform as we move on to more complex, less standardized surveys. Any further discussion? Okay, so this has been really useful. I appreciate everybody on the call today and the contributions to the assessment as well as to today's discussion. I think what I'd like to do is maybe leave off here with some action items. So one will be setting out a doodle poll to see if we can find a meeting time that we won't have to cancel so much. We'll also pull the data from the landscape survey into a table that we can share on the wiki. I will go ahead and remove names and email addresses as far as sharing it on the wiki, but at least the responses. If anybody who participated in the survey has concerns about that, let me know, but I would leave names and email addresses off for the wiki posting of the data. And then I'd like all of us to kind of mull on some of the discussion today in terms of helping inform the OKRs. If you feel up to writing one based on this discussion and want to share it to the group via email, I think in the next 2 weeks, we can start actually fleshing out the text, share something with the group for evaluation when we would have met around the 17th, and then use that to kind of finalize before we present to the community at the end of the month. Does that sound good to everybody? You could do thumbs up or thumbs down if it's not. I don't know if that's an option, or chime in if you have a suggestion for another approach. Okay, great. All right, well, that sounds good. All right, well, thank you so much, everybody, for joining today. I'm very excited about our prospects for 2025 and definitely to have new members interested in helping these efforts. So I'll be staying in touch. And again, if you're not on the regular invite, but would like to be, just reach out in the chat or email me directly. It's just Nicole, what I've got up here, nicole.gerlink@nih.gov. So you can reach me there. All right. Thanks again, everyone. Have a great rest of your week. Bye.
Thanks, Nicole.
Thank you.